Tree pollen, January through June, ragweed, July through November, weed pollen, April through November, and grass pollen, March through October. So we just entered the whole grass thing, and many of you probably see, grasses are growing a lot. You can you definitely notice as you walk outside, cars are turning yellow. If your car looks like that and you look like this, chances are you have allergies. So you can see in the picture, the person has really watery eyes or probably really itchy. They probably have some nasal congestion and rhinorrhea or runny nose. So why does this happen? Many plants and trees rely on wind dispersal, hence the yellow hue that we see on our cars, sidewalks, and windows. One thing to consider during the springtime, when all of us are starting to do some landscaping, is what kind of things you're putting in your landscape. Consider what you might be allergic to, and make sure that you accordingly put plants around that are not something you're going to have an allergy to. There's a really neat scale called the Opal scale. It's the Ogren Plant Allergy Scale, and it basically grades allergies or the ability to have an allergy from one of these plants or trees from a 0 to 10. As an example, oak is a 4. So surprisingly, although oak tends to be one that everyone talks about, a lot of people aren't horribly allergic to oak, but eastern red cedar is a very high allergen. It's at the highest level, which is a 10. So here's some of the symptoms that I was alluding to a little bit ago. This goes into more detail of things you can experience depending upon how severe your allergy is to these allergens. So runny, stuffy nose is very consistent with most people. Itchy, burning eyes, eye or eyelid swelling that can actually turn into a conjunctivitis. Sneezing, facial or dental pain. Sometimes you'll see people, they'll come in, they'll present with, jaw pain. And actually what it is it's the development of a sinusitis due to allergies that occurred. Sore throat, which can occur from like a postnasal drip from all that stuff just kind of accumulating and dripping back to the throat. Cough, obviously can be triggered by that sore throat and from that dripping. Wheezing, oftentimes you'll see this mostly in people who have a history of asthma. As these allergens start to take hold of them and there's an increased inflammation in the mucosa, you'll get a lot of chest tightness and air constriction, and people will have wheezing, and then eczema, which is a rash that people can experience during this time of year from allergies and from dryness. One of the things that's really of note right now is how do you tell the difference between allergies, COVID, flu, common cold? It's a very good question because a lot of these overlap, and especially with coronavirus right now, it's very difficult. A lot of people come in and say, oh, I just thought I had allergies. And they're right. I mean, a lot of these symptoms do overlap, but there are some very key differences that are important to watch out for. For instance, with the flu. Now, we haven't seen a whole lot of flu going around this year. It's been very low throughout the season. A lot of it's been due to, wearing masks, increased hand washing, social distancing. But one of the things that's important to note with the flu is typically the symptoms are very acute onset. They occur very quickly. People say they feel like they get hit by a Mack truck all of a sudden. They also end up with fevers very quickly. Whereas with the allergies, you're not going to see typically a fever with allergies. You might, be more gradual onset where you kind of feel kind of cruddy one day with some, runny eyes, and the next day maybe you have a scratchy throat, but it's a little bit more of a gradual onset. Similarly with COVID, what we've seen with COVID that is a little bit more unique has been the loss of taste or smell, shortness of breath, which is related to the respiratory condition, and then the fevers, chills, and body aches. You don't normally get body aches with allergies. That's not typically a common symptom. You can get headaches, however, because of the fact that you do have the inflammation. Some people have increased sinus pressure, which can then result in a headache. Approach to treatment. So this really kind of varies, and these are the categories I'm going to go over with you today. Mild or episodic symptoms, we'll go over information on that. Persistent or moderate to severe symptoms, comorbid conditions, so things like asthma, pregnant women, breastfeeding women, then older adults, and then we'll talk a little bit about allergy testing. So mild or episodic symptoms. These are those of us that basically have maybe a little bit of watery eyes or itchy eyes, maybe some nasal discharge, but really nothing horrible. It's just kind of an aggravating nuisance for us. In these situations, oral antihistamines like Zyrtec, which is cetirizine, Allegra, which is fexofenadine, Claritin, which is loratadine, typically on a daily basis, are enough to really help control these symptoms. Sometimes what we'll do is we'll add a nasal spray to it if the oral antihistamine isn't doing the job, or if there's just a lot of allergens in the air that are really causing problems. Nasal sprays that are very common is fluticasone, which is Flonase, is probably the most common that we use. There's also Nasonex, Nasacort, and then Nasachrome. For the persistent or moderate to severe symptoms, these are individuals that really are having a rough time of it. Maybe they've got some sinus pressure, maybe they've got the cough, maybe they've got the sore throat on top of it. Sometimes this can be a gradual thing. You may start out with very subtle symptoms that are just aggravating, and then they gradually just evolve over time. They start to become really, really irritative and have a lot more systems involved. For these, we do recommend the initial, which I was talking about, the oral therapy, and then typically the nasal sprays. And then we can add another agent to this, which is normally an antihistamine, which helps reduce histamine, which causes inflammation in the form of either a nasal spray or even an eye drop. Common ones for that are the azolastine that we use quite a bit. And those are prescriptions. So, those are ones you would actually have to go and, have medical attention from your primary care doctor or an urgent care, something along those lines, in order to get treated for that. And with those agents, you can use them daily for as long as it takes for them to actually work. Sometimes you'll see a little bit of a delay, maybe 2 or 3 days before they start to work. So sometimes you just got to give them a little bit of a chance, to work. Now, with comorbid conditions, this is things like the asthma that I was talking about, people that have, allergic conjunctivitis, where they start out with the itchy, watery eyes, and then it kind of gets worse and worse to the point where the eyes get really red. The whites of the eyes get extremely red. You may have some discharge from them. In those situations, we'll use the nasal sprays plus the eye drops, like I was just talking about. And then, like I said, there's a variety of these eye drops that can be used to help control these symptoms, and they can be used daily. Now, with the Flonase, we have a tendency to not use that on a daily basis. Most of the time, I recommend patients to use them for 5 days at a time and then give yourself a little bit of a break. Part of the reason for that is it can cause a little bit of rebound congestion in some people, so you've got to be careful with that. The one medication there at the bottom, the amlazibab, it's approved for asthma and chronic urticaria, but the real thing with this one, the trade name out of it is Xolair. This is actually an injection, typically given by a healthcare worker, and normally done every 4 weeks. But it does help quite well for these allergies. But again, it is an injection. It's not something you can get over the counter, not something you can get by prescription most of the time. There's been a couple one-offs. I think the FDA did allow for some dispensing of this medication recently because of COVID. So some patients who are on it are able to do self-injection with that. Another very important condition, pregnancy. Pregnant women have a number of things that come along during their pregnancy, and they've got to be very, very careful of what medications they are using during their pregnancy so that they don't cause any harm to their baby. Avoidance of triggers is utmost important. It's really the first line. If you know what causes your allergies, stay away from them the best that you can. There's things I'll go into in a little bit that you can do around the house that will actually help with that. But avoidance of triggers is important. Non-pharmacological therapies initially. So those are things like nasal sprays that are normal saline, not the ones that we were just talking about that are prescription necessarily, but if they're very, mild symptoms, you can use just a normal saline nasal spray over the counter at CVS, Walgreens, Walmart, wherever, and do 2 to 3 sprays of that in each nostril 3 to 4 times a day. Typically, it's enough to help rinse out the nasal passage so you can get rid of those allergens. The use of a neti pot can be also very helpful. You have to use distilled water. You've probably heard stories on the news of people getting amoebas and things like that from using tap water. So it's important to use distilled water. And I'll go into that a little bit more detail too of things that can work with that to make it even more effective. For mild symptoms, loratadine or cetirizine, like we were talking about, are safe. For moderate to severe, you may add fluticasone, which is the Flonase. Then pseudoephedrine is only okay if the female is in the second trimester or no history of hypertension. Reason being because there are some studies that can show some issues with the baby, and then of course hypertension, pseudoephedrine can stimulate or increase blood pressure, so you got to be very careful with that, especially in pregnant females. Avoidance of phenylephrine, it's a common decongestant medication also found in herbal therapies, but must stay away from that if, with pregnant females. Breastfeeding women, very complicated. I would really refer people to LactMed, which is a website that really actually you can use for anything, not just for allergies. You can look up any medication to see if it is safe for breastfeeding, and it will tell you. But on the flip side of that, if there's mild to moderate severe symptoms, then Rhinocort intranasal has been shown to be safe. Older adults, this is important because as we get older, we have a tendency to actually develop allergies. Many of us had no allergies when we were young. We did just great. And then all of a sudden, we hit our 40s, 50s, 60s. And before you know it, we're sniffling, our eyes are itching, and we've got, congestion. So you can develop allergies as you get older. And, typically the glucocorticoid nasal sprays like the Flonase and the other ones I was discussing are fine to use. The main takeaway point with this is avoid sedating antihistamines such as diphenhydramine like Benadryl or NyQuil. Some people tolerate those just fine, and that's okay. But you have to realize too that these medications can interact with other medications that may also be sedating. A lot of times as we get older, we may have aches and pains. We might be on muscle relaxers. We might be on medications for anxiety or depression. Those can interact and cause, even more sedating effects. And so we've got to be very, very mindful of that and be careful. So allergy testing can be very useful, especially if you just have no idea exactly what you're allergic to. Allergists out there, can do allergy testing where they basically put little small amounts of these triggers underneath the skin, and they look for a reaction. So that's a blood test you can run for food allergies. Of course, you can also do it for some environmental allergies, and the skin test that I was just talking about. Basically, what it's doing is it's detecting immunologic markers for the allergens that are specific to what's called IgE. This will help practitioners kind of understand what medications we can prescribe or should prescribe that would have a better effect on the symptoms that people are having. We really only do allergy testing if it's necessary, if people are exhibiting severe symptoms or we find that they are resistant to treatment or have those comorbidities like asthma that can compound the clinical presentation or put the individual at risk for complications. So some takeaway points that I really want to kind of talk about here. Number one, I got into a lot of the medicinal things you can use. There are some herbal preparations that I've had patients ask me about, over the years. And I think that, the one thing to understand about herbals is that there's not a lot of great studies with regards to their effectiveness, but also their safety. So, kind of take it with a grain of salt, use them if it's something you're used to using. But there's a couple that have, tend to be a little bit more popular. One is called butterbur. It's an extract or a capsule. The nice thing about butterbur is it doesn't cause the sleepiness, so it can be very good or as effective as like the Zyrtex or Allegras. The main thing though is never get the raw root. Now we're in the age of Amazon. You can pretty much get anything you want on the internet. But don't go out and get the raw root because consumption of that can cause toxicity. So, if you do, go the herbal direction and use something like butterbur, make sure you're only using the extract of the capsule that you can get over the counter at pharmacies. Another one is quercetin. It's basically something that is found in fruits and vegetables. It blocks the release of histamine, similar to what you'd see with like a Benadryl. You can find it in apples, cranberries, citrus, dark cherries, asparagus, tomatoes, a variety of different things. You can also get it as a capsule. There have been some research that have been a little bit suspect as to whether or not ingesting it is giving you enough of that supplement to really make a profound effect on your allergies. But it's something else that has been shown to be somewhat effective. Avoid long-term use of it, much like many of these herbal things, because long-term use can cause some toxicities with it. And you got to be very careful that our bodies, pretty much have most of what it needs through our normal diet. So if you do use those, use them for the short term of when you're actually having these symptoms. So keep a log of your symptoms. Understand the environment that you're around and try to help determine what is triggering it. Are you getting these symptoms when you're outside in a certain area near water? Are you getting them when you're in a certain room in your household? Watching for the different pollens and molds as the season goes on, and trying to understand, what's blooming right now. Was my car yellow today when I went out to it? So understanding what those triggers are can also help you, know how to treat them better and how to avoid them. And then also change your air conditioning filter every 3 months. That's really, really important. I can't stress that enough, because many times you just kind of forget about it. Some of these have some really cool apps now, and they've got these little transducers on the outside of the filter. You could go on the app, and your app will actually tell you, it'll throw a reminder to you to say, hey, you need to change your filter in a month. It's really cool that it does that. It also tells you, how clean the filter still is. You can get those at Lowe's or the Home Depot. Any of those places have that. So that's pretty neat. HEPA filters also can help too. So if you have a HEPA air system in your house, that can be very effective at getting rid of or eliminating all of those allergens. Again, I mentioned earlier nasal irrigation and the use of neti pots. With the neti pot, those can be very, very effective if you can tolerate it. Some people really don't do well with squirting stuff up their nose. I'm one of those, but my mom, she loves doing it every day. Basically a half a cup of distilled water each nostril, and you can actually add eucalyptus to it, eucalyptus drops, which can actually help with the constriction of vessels and help prevent some of that inflammation that you experience with those allergens. So it's extremely effective. It's a great first line without using, medicines over the counter to try, to see if it will work for you. Next is look for moist areas in and around your home, especially during the rainy season. What is collecting water? Are there little gullies in your yard? Are there, pots outside that aren't draining properly? Because that can really increase the mold in the air and make you susceptible to having, those allergies. And then long and short of it, over-the-counter medicines are effective. So start out with that daily, Claritin or Allegra. Add that fluticasone or Flonase and see if it helps. If you run into complications, by all means, reach out to your primary care physician, come into the urgent care. We can help, modify or, tweak some of these things to help you be more comfortable. But it is definitely, we're in the thick of allergy season, and I hope all of these, little pearls here have helped you all. So if there's any questions, I'd be happy to take those.
Thanks, Matt. If you don't have a microphone and you want to send a question via the chat, please feel free to do that. We can check it. Or if you have a microphone on your computer, you can unmute yourself and ask away.
Let's see here.
So I'm not seeing any questions. Matt, are you seeing any questions?
Nope, I am not seeing any questions.
Okay. Hey, Matt, thank you so very much for that great presentation. I'm sorry that you had a little bit of a fire drill before we got started. But thank you again for presenting, and thank you all for being here and supporting our wellness webinar workshops. We look forward to seeing you in the near future, and hope everybody has a great rest of their day. Bye now.
Thanks for your patience, everyone. Have a great day.
Thanks, Matt.